Before we get started, I would like to acknowledge that I am conducting the Zoom from Vancouver on the traditional, ancestral, and unceded territory of the Coast Salish peoples, Squamish, Tsleil-Waututh, and Musqueam nations. I'd also like to acknowledge that psilocybin mushrooms have been used for healing and ceremonial purposes for thousands of years by Indigenous communities around the world. However, today we're going to be focusing primarily on the use of psilocybin mushrooms in the context of the Western medical model. I'd also like to acknowledge the recent hate crime that was committed in London, Ontario, where a Muslim family was killed in a senseless act. I'd also like you to join me all in a moment of silence and solidarity to our fellow Muslim communities across the country. Just take a moment here. Right, thank you everyone. So we're just going to do a few introductions and then we will move right into Q&A. If you did not get to submit your questions before today, please feel free to post anything in the chat, and then Holly, our Director of Communications, will be fielding the questions as we go. So in terms of introductions, my name is Yasmin Sedain. I'm the Director of Training and Operations at TheraPsil, and I'm very grateful to be here with you all today. We're going to get to as many questions as possible, and are really grateful that you are here and spending your time with us. Over to Spencer.
Awesome. Thank you very much. My name is Spencer Hawkswell, and I'm the CEO at TheraPsil. And yeah, thank you very much, everyone, for coming and learning a bit about how the training program is going at TheraPsil. Over to you, Dave.
Hi, everyone. My name is Dave Phillips, and principal trainer for TheraPsil's training program. Very happy to do that, and just really passionate about getting this therapy out in the hands of therapists and healthcare professionals so that we can do it safely and effectively.
And hi, everyone. Nice to meet you. My name's Holly. I'm the Director of Communications here at TheraPsil. I do a lot of our public-facing public education and advocacy work. And I see a few familiar names on the list. I may have communicated with you over social media or through email. So nice to meet you, and thanks for joining us today.
Awesome. Thank you, everyone. And we're going to dive right in. So Holly is going to be fielding the questions. She's got a list that have been sent in before, but as I mentioned at the start, if you want to pop any questions that come up for you right into the chat box, we'd be really grateful. And we're going to try and get to as many questions as possible. So Holly, take it away.
Awesome. So I think to just start off, Dave, maybe you could give a little bit of background about who you are, your experience, and what led you to this moment.
Okay, so I've been a therapist since the late 80s, so a little over 30 years now, and primarily my clinical practice has been focused on trauma and working with marriages and families. I'm also a clinical supervisor, and I teach at the undergraduate level, a number of courses at a local graduate school in counseling psych. So that's kind of who I've been. But as for any clinicians that are immune, I'm sure you know along with me that the unique feeling we have of treating folks with trauma and trauma-related problems, that we try our best and we try to give them the best opportunity at a happy, successful life, and yet it's really hard work and oftentimes ineffective work. And yet it's what it is, and we hang in there. I've always kind of been on the cutting edge of research, always trying to hear what's working. And in 2015, I read an article about MAPS using MDMA for the treatment of PTSD, and my first response was, no way, man, that's crazy. So I just kind of dismissed it. But a month later, coincidentally, I read another article that came out of Johns Hopkins about using magic mushrooms for folks who are palliative and with existential anxiety. And, I didn't know MAPS, but I knew Johns Hopkins. And that got my attention, and I really started into the research. And it didn't take me long, as I'm sure for most of you, to realize, oh, okay, there's something here, something very real, very different. The numbers they were boasting in the clinical trials was like, holy cow, I've never seen anything like this. And so that I kept learning, and eventually was at a place where I had to have my own experience with psilocybin because everyone said you have to have your own experience. So then I did, and I realized, yeah, you really, in order to hold space safely for people, you yourself have to have your own therapeutic experience with psilocybin. And then, one thing led to another, and here we are today. So I love being a trainer. I think I'm skilled at it, and I guess, like I kind of mentioned, the most important part for me as I've developed the curriculum is this not the course that we put together is not like a graduate course in psychedelics. There's a certain body of knowledge we want students to learn in terms of understanding psychedelics, neurobiology, neuropharmacology, and the like. But what the course is really about is a hands-on course, as we conceptualize the course being in 3 categories. So preparation, the dosing session itself, and then integration. And so at the end of the course, which is 10 weeks plus a psilocybin experience for yourself, is that we want you to feel qualified that you can safely and effectively hold space for people. It's a basic course. We envision, advanced kind of training as we go along, especially trying to understand how to include Indigenous wisdom and practice as in this emerging field. But that's where we're at right now, and so excited about the quality of training. We're in our 3rd cohort now, and it seems to be going really well.
Awesome. Thanks so much, Dave. Question for Yaz. What are the eligibility requirements for signing up for our training program? And once you sign up on our wait list, what's the steps from there?
Yeah, absolutely. So eligibility is that you have a professional level credential in psychotherapy or medicine. Preferences given to those working with the human psyche. That you're actively registered with a professional college or regulatory college with a code of ethics. And then finally, that you've got 5 years experience. And then in terms of going through our waitlist, I will let everyone know that there are 800 people currently on the waitlist, and we're very grateful that everyone's being so patient, and we are trying to expand in a way that balances, being really careful in the process that we are learning throughout and that we're not rushing things, but also understanding the need that there are so many people that we really do need to train folks. So this is done in a safe manner. In terms of going through our wait list, it really depends firstly on where our patients are. Patients are our number 1 priority, and that's who we are advocating for. So if folks have a patient that needs support, we'll go to that region right away, get them into a cohort. Secondly, it's based on where our cohorts are based. So we saw a huge need in Victoria and Vancouver first for patients who were looking for care. And I think that's just because TheraPsil's based in Victoria that we had a bit more momentum there. So we started our cohorts there. Then we saw a big need in Toronto and Ottawa, as well as Northern Ontario. So our 3rd and 4th cohorts, 3rd was based in Northern Ontario. It's currently running. 4th is based in Toronto. And the next one that's coming is in Victoria. And so we're just kind of following our patients and also just trying to have a few practitioners in each province of Canada. So that's kind of how we're working through the process.
Great, thanks so much, Yaz. This is a question for Spencer. So first off, can you explain what a Section 56 exemption is? What does it allow one to do? And what is the application process like?
For sure. So a Section 56 application is really, it's actually a statement. The application is almost somewhat undefined, but Section 56 is a piece of legislation in the Canadian Drugs and Controlled Substances Act, which allows the minister to allow any person or class of persons access or exemption from any of the articles in that exemption, or in the CDSA. So essentially it means that she can allow anybody to be exempt from any of the laws that might prohibit access to psilocybin. So it does not, and I think that's important, it does not mean that that person is able to legally purchase or that anyone is able to legally sell psilocybin. It does not mean that psilocybin is suddenly a medicine. It simply means that this person will not be charged for using psilocybin. And in those exemptions, there are often a couple little stipulations. And so some of those stipulations were, how much is this exemption good for? Where is it to be used? An example in this context is it is to be used with a healthcare practitioner. That's an example from the patient applications, and for the healthcare practitioner applications, it was stipulated that it was to be used in accordance with a training program, with TheraPsil's training program. And so I think that's important, is there are many limitations to those Section 56 exemptions. Now, Section 56 really is at the, it's up to the minister to make a decision who gets access and who doesn't. However, in past cases around cannabis, it has been made clear in court that the minister is supposed to be following and aligning her exemption with the Charter of Rights and Freedoms that would say that you would discriminate against anyone. So it is quite an arbitrary process, but it is one where you have to submit an application to Health Canada. We've put together an application process, and where the minister or Health Canada is then able to respond. And that really is, the problem that we seem to be facing as an organization today is Health Canada and the minister are not designed to be responding to, every patient or healthcare practitioner who needs access to psilocybin. And it would almost be akin to having to go to the highest levels of government to get access to your patient's medication, or to get access to your own medication. It's unsustainable, it's unscalable, and it may also be unconstitutional. Was that all the answers? Was there anything else in there?
Could you maybe talk a little bit more about what the application looks like, or what goes into it?
Yeah, for sure. I mean, it's nothing major. It really is a request, and much of the work that we put in is behind the scenes. It's informal. There's no single sheet of paper. So an example is, in order to get the exemption for patients, there was a ton of work put in. This is how we're going to be, taking them through an inclusion process, right? Our patient inclusion process, to make sure that we're not, supporting anyone who psilocybin may be unsafe for. And here's the process we're going to use: a clinical protocol to treat patients. Now, it's hard for Health Canada to say, okay, this program is approved, right, for psilocybin use, because it's not up to them to make that approval. However, there's certainly an amount of confidence, right, that a certain person might have access. It really is, again, up to the minister and government. So yeah, I would see that a lot of the work that we've had to put in behind it is setting up the right training programs, right, for the clinical use, the right treatment protocols and inclusion protocols for patients. So there is quite a bit of work around, and it is all in the name of safety.
Great, thanks, Spencer. This next question is for Dave, and this actually came out of last week's webinar, where Dave actually was explaining his own personal experience with psilocybin therapy. So I hope whoever asked that is on this call or will watch this recording. But how long is the average therapy session with psilocybin? And did you write down any journal entries afterwards, or did you just try to remember the experience? What did that integration process look like for you?
Okay, so I mean, you might ask me kind of my own experience or what our practice is in general. So the experience from the time of ingestion to the time that we take the shades off is about 5.5 to 6 hours. So it's in there, and even though the person at the end of the 6 hours might still be a little within the experience a little bit, we stop the session in general, unless they're really unstable. But that just doesn't happen very much. So we really want to make sure that the session goes about 5.5, 6 hours long. And yes, we journal everything. So as a person who holds space, anything they say, I write down. And if they get talking a little bit, I record on an audio recorder. It's only for them. It's not, I mean, the recordings, any recordings they make only go to the person. And then when the session's over, because you really can't talk very much to a person in a psilocybin experience, because they're first of all, their default mode network has been dissolved, and they're not really on the same level that we're on. Secondly, also, when I've tried to talk to people during a session, I noticed that what happens is their trip is continuing on at a very fast pace. And so, they really can't, it's almost like, I'd like to talk to you, but I got to get back over here. So really, we save the talking part of it till at the end. We usually have about half an hour at the end where we say, okay, you said this. What was that about? And we find that that conversation afterwards really does help integration, because the way I said it, it starts putting left brain structure around something that's been largely subcortical or right brain in nature. So it helps them remember things. And so, yeah, we record, we write down, sometimes we talk, and we do audio recordings as well.
Great, thank you. An individual wants to know if there's been any problems with using psychedelic medicines in terms of the regulatory colleges. Have we heard from any of the colleges that they don't like what we're doing? And I'm not sure who this should go to be honest.
Yeah, I don't know. I'll say, you know, I know within the Johns Hopkins trials, New York University and Imperial trials, that they had an age restriction, so they weren't seeing minors in and that's in the research phone, because they needed to keep their controls pretty tight. I think there's nothing that necessarily says that a psychedelic experience would be dangerous to a youth, but at this point in the development of the therapeutic model, it is not actively being offered to folks. Now for obviously for patients, that could be a different story.
Mm-hmm. Sorry, Dave, I'm not sure if the question kind of, if I didn't explain clearly, the question was more about regulatory colleges, like I don't know.
Yeah, to date, Holly, we haven't run into any issues with regulatory colleges because in the experiential session, in the way that we're moving forward, it will be legal based on obtaining a Section 56 exemption. And therefore, there haven't been any problems. There's folks that I've spoken to in our Ontario cohorts, and their regulatory boards were actually completely okay and on board with this. So far, no issues to date.
And I can also make a clarification point here that, you know, some people say like our doctors prescribing psilocybin, and it's important to clarify this is not about a prescription of psilocybin. It's simply saying that this patient is who they say they are, and that the application is not between the doctor and the minister, but it's actually between the minister and the patient. So this is a person claiming their right to a substance, psilocybin. And as far as the doctor, therapist, anyone else is involved, is, you know, their position there is to support that patient, you know, through harm reduction and in any way they can. And in some ways, I think there's actually an argument to be made for an ethical obligation, right, to do no harm to that patient and to support them. Whereas the opposite would be maybe to ignore them and pretend they don't exist. And it's hard to say that that does much good.
Okay, thank you. Hopefully that answers the question. A lot of folks are interested in knowing how the curriculum came to be and what approaches were used to create the curriculum.
Okay, so I'll take that one, Holly. So Bruce Tobin, myself and others were, you know, involved in the kind of trying to frame out the didactic portion. So here's the knowledge base that we want people to have at the end of the course. Now, for me, since I was being contracted as trainer, I mean, I had to write the curriculum for this course myself. And so, you know, of course, I've looked at many different course curriculums, and to be quite frank, most of the courses I looked at were, again, they were like graduate level courses in psychedelics. And while I think any learning in psychedelics is useful, this training course is a skills course, right? So it, like Spencer said at the start, you don't even qualify for the training unless you have some sort of certification going in. So we've already kind of covered this professional training. Okay, so the kind of the metaphor I've used, if you can imagine building a bridge. Okay, so if you're building bridge, we're not doing the engineering, we're not doing the high level stuff. I'm like a welder teaching welders how to make good joints so that the bridge is strong. Okay, and so when I developed the curriculum, I followed the Johns Hopkins model of the 3-phase approach of preparation, dosing, session, and integration. We are not constrained by the number of sessions that they are in the research trials, but that's the general flow we've done. And then for each one, I've tried to, based on my own clinical experience, but also based on kind of knowledge that's out there in the field, try to embed the most important principles. Then as I started teaching the first cohort, because I've taught for a number of years at the graduate level, I kind of understand what's important in terms of the didactic pedagogical end of things. I was able to come up with a cohesive philosophical framework that guides all areas of treatment. And I think having that cohesive center is really important. So, the burden that I put down onto my course is that after you've taken the 10-week course plus the experiential piece, that you will be qualified or trained to safely guide someone through a psilocybin experience. It's not like this is a neutral substance. We all know stories about people who can, say go out with friends, grab some mushrooms, and have a very, very disturbing kind of what we'll call negative or bad trip. And so the burden on the training is to teach the therapist on two ends. First of all, to mitigate the chance that someone is going to have a negative experience. So safety is like really important. And then how can we maximize the potential that the intentions that they come in with are going to be realized? And so that's how I wrote the course. Say kind of going on my own clinical experience, lots of research, but really there haven't been any strong training courses in the field right now. So kind of making it up as we go. But so far the feedback I've got from folks in the courses has been really helpful.
Great, thank you, Dave. A very valid question coming up. So what about other programs, such as the few being run in California? There's 800 people on our wait list, which seems kind of encouraging when cohorts are only like 20 people at a time. So how can somebody get involved in training sooner?
Yeah, absolutely. And I think absolutely there's amazing other programs that are, there's CIAS that you could absolutely, or CCM that you could reach out to see if you can get engaged with them. I think what differentiates our cohort is that there is an experiential component in obtaining the Section 56 exemption. That being said, Health Canada has been slowing down their acceptance towards Section 56. And so that's something to note. But yes, there's wonderful other trainings. We of course are, we're enthused at how long the waiting list is. And right now we're actually trying to work on partnerships with other organizations so we can train more people, and also working on getting more trainers trained up so we can work through that list. We did just release our first training on March 1st, and that was a beta with Dave Phillips, and then another beta at the end of March. And so currently we've got 4 training cohorts that are running, and then we've got a partnership one coming up in July, and then 4 others coming up in September. So we're doing our best to once again manage the needs of the wait list, as well as learning through the process and taking it slow, because we don't want to rush anything. This is serious work, and we need to make sure that we're really taking it slow. But I think a solution to this will be creating partnerships with other organizations, and also just having more trainers to train. So that's what we're working on currently.
Great, thanks. It's super early days. I know we've been working on the training program for a long time, but that took a long time to get up and running. And now it is, a slow burn to scale this safely and effectively. So great. An individual is interested to know, can you do psychedelic sessions in a therapeutic context outside? And how is a soundtrack prepared?
Can we take that?
Yes, please, Dave.
Okay, so I'll do the second part first. So the playlists that we use there's many curated playlists out there specifically for therapeutic use of psilocybin. But the 2 kind of main ones that you've seen that emerged in this field are Bill Richards, the playlist that he curated out of Johns Hopkins, which I think are really, really good if for people who are facing death, but also when you're like having to break big patterns that have been entrenched for a long time. But the person that I'm really intrigued with these days is Mendel Kaelin out of Imperial College. And Mendel's now started his own company called WaitPaths, and is really doing some really interesting research into how to maximize the use of the playlist towards, again, good outcomes. So I actually think of the playlist as a co-therapist in the room. That's how intelligent these playlists are to kind of match the emotional fabric of the psychedelic trip to kind of how the psychedelic works within the body. And the first question again was
outside, being outside.
Yeah. Okay. So I mean, I'll give you my bias here. Okay, there's many different ways a person can take psilocybin for sure. I mean, and you can go from ceremony to like friends doing it together to going outdoors, and clearly nature seems to be an important part. One of the pieces that is true about the therapeutic model the Western therapeutic model that has been developed is that we're actually trying to shut down as much external stimulus as possible. So that's why we put shades on. That's why we use the headset, is we're trying to focus the brain's kind of processing power internally to do the work inside. Now, if a person wants to go outside, I mean, of course they can go outside. But again, we do find that for the purposes of this very kind of narrowly defined use of psilocybin, this therapeutic use, that we find that we're trying to actually cut down the external stimulus as much as we can.
Thanks, Dave. Just a follow-up question to that. Can you spell the name of the artist that you were referring to regarding soundtracks?
Yeah, his name is Mendel, Mendel, and Kaelin, last name Kaelin. Thank you. Yes, yeah, and he's not a musician as much as he is a researcher, and
Fantastic.
Yeah,
Mm-hmm.
Just fantastic.
Great, thank you. This may be a good question for Spencer. So do you think there is a national certification that's pending specifically for trainers in psychedelic psychotherapy? And follow-up question for Yaz, are there CE credits?
Yeah, for sure. And I'll just do my best to answer this. And it really is like, I don't know yet. Right? A national certification takes quite a bit of, I would imagine, cooperation from different institutions and organizations. So it's nothing we can say yet, or that we're necessarily certifying. Dave or Yaz, do you know anything about this?
I haven't heard anything.
no, I think,
Yeah,
I would answer the same as you. I think, in the next 5 years, personally, I think that's going to be an important part. Again, just this is not a neutral substance, right? So I think because it's a powerful intervention, that we do want to be able to get to the place where if someone wants this therapeutic intervention in their life, there's got to be a way, I think, to be able to vet the therapist, to be able to say, are they qualified to do this? Am I in good and safe hands? Is it ethical? I mean, ethics, we even talked about this, but ethics in this field is not even been defined yet, and yet so important because the patient is in such a vulnerable condition. So these are all reasons why there needs to be just an effort to develop some sort of certification process. But like you said, Spencer, we're so early in the game, it's just not emerged yet. I mean, I think being able to take a course like ours or School of Consciousness Medicine or many of the others is a really good first step in that direction. At least you submitted yourself to some sort of formal training that can tell people, okay, I'm trying to do this safely and ethically.
Yeah, for sure. And in regards to the CE credits, yes, we were just approved for 160 hours of CE credits for CPAs, for people who belong to the CPA. So Canadian Psychological Association have approved us for 160 hours. And I just saw one question come through that I can also answer quickly. In our curriculum and the TheraPsil protocol, two people must sit through a journey.
Yeah, I'll just follow up on that. There are other perspectives in the field, but for us, that's primarily mutual support. But at the end of the day, it's also protecting the patient. We believe that 2 therapists in the room for 6 hours in this vulnerable condition begin to ensure the safety of the client, and that I would say, I don't know, Yaz, I would characterize that as a very strong value of our program.
Yeah, it's extremely important.
Wonderful. So if somebody already has maybe done CIIS training or CCM training or other courses and have had their own therapeutic experience with psychedelics, is there a way they can skip modules or kind of fast track the course? Do we have
challenge the course sort of thing?
Yeah, challenge the course. I'm sorry to whoever asked that. I didn't know what challenge the course meant. So
Yeah.
I'm so sorry.
Yeah, I'd ask them to get in touch with me and we can figure out course equivalencies perhaps. With some other folks, they've gone through a few modules, but it really depends on which training they've done and whether the curriculum they have aligns with their skills.
Okay, great, thank you. So I'm just going to type here in the chat. Actually, Yaz, if you could type in the chat the email where folks can reach you if they have specific questions, while I ask another question. This is a really good one for Spencer, and it also involves a lot of the work that we're currently doing. So when is psychedelic psychotherapy going to be available for the masses in mental health care? A big question, I know, but.
I love the question.
Yeah, that's a fantastic question, and you know, my charged answer would be when our government starts doing its job a little bit better. You know, for the masses, there are so many things that need to happen here, and obviously safety is one of them, right? Training, and I think this is the reason that, you know, when we built TheraPsil, the organization, it wasn't just about allowing Section 56 exemptions. And again, I think I used on the last webinar, I'll use it again. So, you know, you can't just make, you know, chemotherapy available to the masses if you don't have radiologists, oncologists, therapists, nurses, everyone else trained in order to deliver this to the patients. So it's a lot of education that needs to be done. And education does not get done when you have outright prohibition of the substance, especially if there are patients using it. So, you know, it's going to take a while if the government continues to be slow and stop and not listen and ignore patients and doctors. And what they should do is listen and help with this, with a careful rollout of this, so that, you know, patients who need access and who are using it can get the support from psychotherapists and doctors and nurses and counselors, etc. And all of those healthcare practitioners who want to learn more about it have an option to do so. It's not illegal, you know, and so they can take the training, whether it's training provided by, you know, us or Dave, or, you know, the many different institutions who I'm sure are quite eager to start training again once this is more accessible. So to answer that question, we'd have to have some insight from the regulators, from the government, right, whose job it is to respond, and when there is unjust, unconstitutional, and so the drug laws, to start to turn those around and allow these substances to be made more available to the masses. But the unfortunate thing is it's going to take a while. It's going to take quite a bit of time, because education takes time. It really does. You know, being able to normalize these and do the amount of research that still needs to be done. It's all going to take time. So unfortunately, I can't answer that completely, but it is my hope that in the next couple of months, we do see some solution to at least the Section 56 exemption problem that we have right now, as there's a ton of healthcare practitioners and patients who have been waiting for, you know, months and months, while others have had their exemptions given to them. So there's a problem now that definitely needs to be solved, but definitely a bigger one that might make it, you know, accessible the same way other medicines are.
Thank you, Spencer. Yeah, I mean, that's why we exist, right? We're a patient advocacy organization. We realize that Section 56 exemptions, while they opened the door, they're not a way to access healthcare. So we're in the very, very early days. And if you're interested in advocating alongside us, please follow us on social media, please retweet, please tag the minister, Minister Patty Haidu. So there's a lot of ways to get involved. You can write letters to the minister, and feel free to email us if you're interested in getting more involved with, like, letter writing campaign, for example. Really good question. How much does the program cost? Yaz.
Yeah, so the program really depends on which trainer is administering it. So it will vary from cohort to cohort. For example, the one that is currently, that Dave's running right now, is in the range of 2,000 to 2,500. Another, yeah, it varies from cohort to cohort based on the trainer, but that is how much Dave's costing right now.
Wonderful, thank you. Sorry, there was a lot of questions and I'm just siphoning through them here.
Good, I love that. Glad there's
Yeah.
questions. That's great. That's what we're here for.
Let me see here. Yaz, could you expand on qualifications, particularly folks are interested in, you know, if they're in a master's program, are they eligible? And, you know, do you have to be a doctor or therapist, or what other types of healthcare professionals are currently enrolled or could be enrolled?
Absolutely. So right now our focus is definitely for those working with the human psyche. So a background in therapy is definitely prioritized. Same with folks, there's also priority given to those working with palliative care patients and underserved communities. In terms of belonging to a regulatory body, or perhaps being in a master's program, we are accepting master's students, What I will say is in the Section 56 exemption portion, there's a chance that Health Canada will not approve that exemption because you are not yet completely qualified, but we do have several master's students in our Toronto cohort right now. So yeah, that's kind of it.
Thank you. Spencer, what would it take to get Minister Haidu on one of these calls so we can speak with her directly?
Love it.
That's a great question. You know, the minister, again, it's her job to respond to the public in matters of health, and obviously by making noise, right, and not letting her or her office get away with ignoring this issue is a fantastic way to get her attention. So, you know, I know it seems like sometimes you're a drip in the ocean, but having doctors, therapists, healthcare practitioners who, quite frankly, have never, I think, had such a voice since this pandemic, and have really, you know, showed how important they are. I feel like the minister owes them, you know, the duty to listen to what issues and challenges they're facing. So, you know, let's just look at what worked in the past, right? What worked last August and what worked last November as we were trying to get patients and then healthcare practitioners their Section 56 exemptions. Those patients and healthcare practitioners, I don't agree that this is the way it should be done in our country, but it's what worked is they put themselves on social media. They sent letters to their MPs, letters to their friends, to send letters to their MPs and to the minister, and made themselves incredibly public, asking for this access. And again, it's unfortunate that you've got to, you know, air your dirty laundry for the minister and all of Canada to see. If you want access to a substance, that you've got to go on the front page of the Globe and Mail and put yourself on Facebook. I detest this as the way that we need to get access to medicine, but it's effective, it works, and it can't be ignored. So I would encourage everyone, you know, to send the minister a letter. And if you need to do that, let me know. Let Holly know. I'm sure we'll be able to post something like a letter writing campaign of what you can send and what we've been sending to which email addresses. You know, find your MP and CC them as well. This is a matter for our elected officials to deal with, and they're the ones who are most enabled to. And it's their duty as they're sworn into office to listen to their constituents and help with these matters, especially matters that are unconstitutional. And that negatively affect patients and healthcare practitioners. So again, it may seem like you can't do much, but really every letter helps. And if anyone is interested, especially if you're a healthcare practitioner, which I imagine many of you are interested in training, you may have seen that out there. So we've been posting videos and highlighting people posting videos to the minister, essentially saying how they feel and whether or not they have patients or whether they need access. That stuff's important. It doesn't go unrecognized.
Mm-hmm. Wonderful. Thanks, Spencer. I am cognizant of time. We've said this is a 45-minute webinar, so we got 5 minutes left. So I'm going to do my best to just fire off these questions. Let's start with you, Dave. Can you speak a bit to the difference between using psychedelic psychotherapy in a Western context versus having experience in other spaces like spiritual or ceremonial use?
Yeah, and my experience personally is within the therapeutic model. Of course, have lots of connections with folks in other models. I think at this point, because we are dealing with a Western government and a medical system that has certain kind of regulations, we've had to kind of start that way, but with great humility. We look at millennia and millennia of wisdom that has informed the use of psychedelics in those contexts. And all I can say is I think that's the next kind of level of integration in our training programs, is beginning to bring that wisdom and those practices in a very safe, effective way that makes sense to this cultural milieu. But you look at someone like Francois Bourzat, who I consider like a real leading voice in this space. I mean, she was trained Western, but she was like mentored and apprenticed within the Mezteca folks in Mexico, and so really learned her craft in that. And I think if you read her book, Consciousness Medicine, she's a person that's really trying to do some integration of these two models. And like I say, personally, as I see the kind of evolution of our training format, you're going to see that we're going to try to include more and more of these practices from that framework. Again, I say that with greatest of humility, because my experience is within the more Western trained therapeutic model, and I just don't feel like I can intelligently right now talk very much about that. But we will include lots of different voices in this training program as it morphs, develops, and evolves.
Great, thanks, Dave. Really great question, more about the patient side of things. So how much does it cost for a patient to access this therapy? What happens if they can't afford it? How do they obtain the mushrooms? Somebody can speak to that. Spencer? Yaz?
Yep. Yeah, sure. I can quickly answer the patient cost. So patient cost really is up to the patient and the therapist. So, the cost of the exemption, it's really just administrative. It's not much. And if patients can't afford it, it's provided for free. So it really comes down to what is the cost of the therapy. And it can be expensive. It can be anywhere, I would say, around $2,000 to $3,000, because it is time, right? It is time with a psychotherapist, and sometimes multiple therapists in a room for the session. So, it may look like 3 sessions, each 2 hours, right? Therapist may be billing anywhere from $100 to $200 an hour. And then your psychotherapy session, which could be about 6 hours, and then integration sessions. So it's really like, what's the cost of therapy, and now effective therapy. And I think something that we need to look into is, how is therapy normally covered, right? Does the province cover it? What's billed, what isn't? What insurance covers therapy? And how effective is that therapy versus maybe some psilocybin assisted psychotherapies? And I think what we've seen a lot here is that when you're actually, I don't want to say the word curing, but really, really solving some of the issues that these patients face, and getting to the root of their depression, anxiety, hopelessness, in the long run, ideally there's much less therapy needed, right? And this is about dealing with things instead of ongoing therapy for years and years. So upfront, I would say it's expensive, unfortunately, and we definitely want to make sure as an organization that the patients get access to something we're working on, is a patient access fund, so that anyone who can't afford it can help get some subsidy. So cover a couple of the hours, do whatever we can to make sure it's affordable for them, because that obviously is a barrier to health in this country, right? Is how much time you can afford to spend with a therapist. And Yaz, I know you might have wanted to say something. Anything I might have missed?
No, I was going to mention the Compassionate Access Fund as well. So, yeah.
And maybe I'll just throw my 2 bits in, Spencer. I think one of the main reasons I chose to align myself with TheraPsil is because this is, fair access to all is such a core value of TheraPsil, and that we're not kind of trying to make profits off other people in this space, and that's really important to me. As we look into how the experience might be vetted, or might be how it might shape as we move forward, we can imagine down the line that using retreat center formats, for example, to be able to really cut the kind of large cost down. And then integration is the area where I think it's really ripe to be able to do a lot of group kind of activities that really take the user costs down, involve paraprofessionals, these sorts of folks in the space. So I would say personally, but I know for TheraPsil, that this is a really high value, that we find ways to make this treatment accessible to any Canadian with a mental health problem.
Absolutely.
Yeah. And yeah, just to add on that, TheraPsil doesn't come up with the cost of this therapy. Once a patient's been approved or received their Section 56 exemption, our clinical intake team will then refer them to therapists who have been through our training and who are competent and ready to take on these clients. And then that therapist sets the price of the therapy. But as Dave said, we are setting up a compassionate access fund. So if patients cannot afford the therapy, we work with the therapist to figure out how we can subsidize that for the individual. Adding
on, as Brenda mentioned, there is extended health coverage for those who have access to extended health.
Absolutely. The only part that may not be covered is the actual session where
dosing
an
session.
individual is ingesting mushrooms, because I don't think there's a billing code for that yet, but maybe that's something we can work on in the future.
Yeah, and it looks like some of the folks we're working with can bill 1 hour for the session, so at least it covers a little bit.
Great.
The talk therapy portion.
Fabulous. Well, I understand it's everybody's lunch hour, so I will kindly bring this meeting to a close. Yaz, any final thoughts? Spencer, Dave, anything you'd like to say to wrap up?
Thank you so much for joining us, everyone. We appreciate all the support, and yeah, we'll be in touch. Thank you so much for coming today.
Thank you so much for taking the time.
Just thank you. Thank you.
Have a great day.
Good night.